Alright, no? So, for the second part of our discussion, no, um, postpartum exercise design, no? So, if ever si patient, no, medyo na-enjoy niya yung prenatal exercises niya and would want to continue to live a healthy lifestyle or become active, no, physically active, no, you can do so, no? You can offer the patient postpartum exercise design. Okay? But before kayo magbigay, no, the client should check with her healthcare provider before starting an exercise program. Okay? So the amount of time needed for recovery after the vaginal delivery or cesarean section can vary widely between women. So with this, kailangan muna niya ng clearance from her healthcare provider before going to proceed with the postpartum exercises. Okay? You might also need to, hindi kasi ganun ka-common here in the Philippines, yung postpartum exercise programs. So, you might want to coordinate with the physician, no, to have a certain discussion, okay, with regards to postpartum exercises, no, para if ever merong mga alanganin din yung physician herself, okay, po pwede nyo rin ma-discuss, no, how safe it would be for the patient or merong certain concerns yung physician, pwede nyo nang mapag-discuss. Okay? So, yun yung important part here, no, before starting. Okay? If a client, no, had a cesarean section, okay, she should wait, no, until her surgical incision has healed and the physician clears her for exercise, no? Pero kapag vaginal delivery, no, she should just wait until she is no longer experiencing bright red vaginal discharge. Okay? So, kung wala na siya ng bright red vaginal discharge, pwede na siyang magpaalam dun sa healthcare provider niya. Okay? So, once na na-clear na siya, no, kasi we don't know if merong comorbidities or wala. So, once na na-clear na siya, yun na. Pwede na siyang mag-start ng postpartum exercise program. Okay? So, as mentioned before, no, breastfeeding women may need at least an additional 500 kilocalorie per day. But it would have to be more than that, no, if the mother, no, is exercising. Okay? Alright, no? So, what if nag-start na siya, okay, ng kanyang exercises? What are the signs? No? Meron pa rin tayong mga i-watch out na signs and symptoms to terminate the exercise program just in case, no, na magpakita si patient nitong mga signs na to. Okay? Fever of 100.2 Fahrenheit or higher for 24 hours or longer. Okay? So, dizziness, nausea, faintness, or extreme shortness of breath, bawal din. Red, warm, painful area on either breast or excessive breast tenderness, bawal din siya. Okay? Inability to urinate or pain with urination. So, ito mga kailangan talaga itigil. Most likely, baka may UTI si patient or much more than that. Loss of bladder control or leakage on exertion that continues 4 to 6 weeks post-delivery. Kasi, ibig sabihin na to, if it continues 4 to 6 weeks post-delivery, baka malala na yung weakness niya, right, ng pelvic floor muscles. No, baka magkaroon ng prolapse, no, if magpatuloy siya on exertion, okay, and then binaliwala lang natin. So, you would have to stop the exercise program and then refer her back to the physician. Cesarean incision opens or has increased pain or drainage. Okay, although ito medyo hindi naman to magiging worry because entertain lang kasi natin si client, no, for postpartum program if, no, nag-heal na yung incision. So, wag natin ipipilit na hindi pa siya ganun masyado healed. You will know this because you will be doing the scar mobilization for the patient or kaya naman yung mother yung de-describe, no, kung ano na yung itsura ng scar. red, warm, tender, or painful area on either leg. This signifies DVT, or deep veins thrombosis. So, common din yun na nagde-develop sa women kasi. No? So, ayan. Isa yan sa i-watch out. And then, severe pain anywhere sa body niya. Okay. So, these are the warning signs and symptoms. Okay. Now, for the exercise design, no, this is almost the same from the previous, discussion sa prenatal natin. Meron lang mga certain changes, no? May mga certain different approach lang tayo since dito wala nang baby, no, within the mother. So, for example, na in your intensity, no, pwede nang mag HIIT. Okay? This may boost fat burning. So, I believe in your TheraXT, no, you might cover this one or have already covered this in the past therapeutic exercises. So, pwede na mag-start si patient dyan. This is as long as tolerated, syempre, ni patient. Okay? You do not need to overload it. Okay? Kahit na wala na siyang baby, no, na dala-dala, you don't want to aggressively progress naman yung patient. Kasi, remember, no, na we would want the client pa rin to be compliant, no, with our exercise program. So, same as sa prenatal, no, kung ayaw nating, if we want to increase the compliance of the client, same as here, no, ganun pa rin ang approach. We would want to make the patient or the client compliant pa rin by making it easy, no, especially medyo if-fit nyo na into daily routine kasi magiging busy na yan na she would have to take care of the baby. And before, no, we are utilizing talk test and RPE, no, or your rating of perceived exertion scale. But for this postpartum, since medyo nagde-dissipate na yung mga hormonal shifts that is happening during the pregnancy, dito pwede na kayong mag-rely sa or mag-depend somehow sa heart rate, no? Before kasi hindi, 'di ba? So dito pwede we will still try to achieve the 3 to 4 RPE, yung moderate to somewhat hard. And it is up to the patient's tolerance if you would want to increase the intensity of the exercise, no? As for the heart rate reserve, no, I assume marunong na kayo dapat mag-compute for the heart rate reserve. For obstetrics, no, sa mga mothers na, okay, the percentage, no, to compute for the HRR would be within the range of 70 to 80%. Okay? 70 to 80%. But you can start, no, with lower intensity. Pagkaka-start pa lang ni client sa'yo, no, you can start as low as 60%. Okay? 60%. Now, for the frequency, no, yun pa rin, we still favor na mas frequent ang exercise niya. So, 5 to 6 days per week, but consistency is ideal, no? So, 5 to 6 days per week, but consistency is ideal, no? So, kung hindi kaya ni patient mag-commit sa 5 days per week, ang kaya niya lang is 2 to 3 kasi nga may inaalagaan na siyang bata, no? So, sige, you can give active rest program na lang dun sa araw na hindi mo siya mamamonitor. Okay? So, consistency dapat. Weight loss goals, no? If weight loss ang gusto ni mother, no? More frequent, longer duration exercise program. So, definitely magpo-fall siya under this one. 5 to 6 days per week. No? Pero kung hindi kaya, no, you can still adjust that. But make it consistent. For the type, no, fits into daily routine dapat siya. Okay? Majority of the exercises should fit into the daily routine of the mother. Okay? Especially kasi pag nag-aalaga ng bata, medyo mahirap, no? Ito yung sinasabi nila that they would have sleepless nights because of the child, no? Na iyak ng iyak pagkagabi. Okay? As to duration, no? Para talagang magiging compliant si patient, we would want to start it at 10 to 15 minutes only. So, hindi siya ganun kahirap, no? Kumbaga, it really is possible for the mother to be compliant with the exercise design. Kasi hindi siya ganun katagal. If possible, you can increase by 5 to 10 minutes every other week. Okay? And then, up until ma-achieve nyo yung peak ni patient wherein ma-reach na niya yung HRR with 70 to 80% range. For the strength training guideline, no, yung kanina, right here, this is for aerobic exercises, no? You can squeeze a little bit of around 3 minutes for major muscle group of strength training, no? Especially the upper extremity. Okay? Para ganun pa rin, no? Syempre, bibigat yung baby para ma-prepare siya, no? Sa long carry ng bata. Okay? So, at least one set of 10 to 12 reps per exercise. And strength training should be at least 3 days per week, kahit dun na lang sa bahay. Okay? And then, include active rest, just as katulad sa slide natin before. Okay? Now, let's go to the common postpartum issues. No? Paano natin i-manage tong mga common postpartum issues? So, we'll discuss this with the next part of the lesson. No? So, that would be for the part 3. Okay?